Good afternoon. My name is Dr. Michael Hooker. I'm here to talk to you guys today about osteopenia versus osteoporosis. This is an epidemic in our country and something that any person over the age of 20 probably needs to start thinking about. It is most common in women, particularly white women, and it affects all women over the age of 50 as you begin to go through menopause. Over the course of about 7 years after menopause, you can lose up to about 20% of your bone mass. So everything that you do in terms of your diet and your exercise prior to menopause makes bone. Everything you do after menopause doesn't count as much because the loss of that estrogen is what ultimately leads to loss of bone. The thing I want to try and draw your attention to is what healthy bone looks like. This is a model of healthy bone, and what you see is it's pretty densely packed. It's got nice small cells of cancellous bone there, and it's very sturdy. It holds a lot of weight. As you lose bone, and what osteopenia and osteoporosis mean is that you're losing more bone than you're making. And as you lose more bone than you're making, all these little cells get bigger and the holes get thinner and thinner. And this, as it occurs, leads to fracture. The fractures that are most common with osteoporosis are fractures of the spine, and that's what gives older ladies in particular this stooped posture, is that the vertebral bodies just collapse down and it causes that spine to kind of bend over. The other place it's really common to get a fracture is the hip, and as you age, hip fractures become much more common, and hip fractures can lead to a really high rate of morbidity and mortality. Lastly, the wrist. Broken wrists happen because the bone gets thin. So how do you know if you have osteopenia, which is bone thinning, but not so much as osteoporosis? You have to get what's called a bone density test. And that's a simple test done with what's called a DEXA scanner that measures the bone density of your hip and your wrist. That is compared to people your age, which is considered a Z-score, and it's compared to people that are in their 20s, and that's considered a Z-score. Those two scores tell you if you have osteopenia or the more severe version, osteoporosis. For patients and people with osteopenia, the treatment is exercise, weight-bearing exercise. So you want to do strengthening of your body. You want to lift weights a couple times a week, ideally. You want to walk. You want to move your body. Those are things that are really helpful to get the bone to see load and to build more bone. The other things you want to do with osteopenia is you want to make sure that you're getting calcium, 1,200 milligrams a day, and you want to make sure you're taking some vitamin D to help you absorb that. So dietary-wise, the things that increase bone loss are drinking sodas that have a lot of phosphorus in it. That increases bone loss. Caffeine reduces calcium uptake, which inhibits bone reformation. And high alcohol consumption also reduces calcium absorption and intake. So those are the things that you need to do to help kind of avoid your bone loss. In terms of strengthening the bone, making sure you're getting a good balanced diet, doing the strengthening training, the weight training that we talked about, and then supplementing with the calcium and the vitamin D. If you have osteoporosis, if you've gotten a DEXA scan, and for anybody over the age of 60, a DEXA scan is probably important just to know where you are. If your DEXA scan score shows osteoporosis, then you probably need a medication to help reverse some of that bone loss in addition to diet and exercise. And there are multiple medications that treat it. I won't really go into that now, but that's my simple overview of osteopenia and osteoporosis. We don't want to see you in our orthopedic clinic because you broke your wrist, your spine, or your hip. That's no good for you, even though it's good for us.